Hey everyone, this is Mike Plackey. I'm a physical therapist, owner of Plackey Physical Therapy in El Dorado Hills, California. Here today to talk to you about how to wake up in the morning feeling great. In physical therapy, we work on people, whether their necks or lower backs, they leave here generally feeling a lot better, they're moving better, they're doing their exercises, they're sitting with good posture, they're lifting correctly, but sometimes people still come back sore for the next visit. So something obviously is going wrong between when they leave here and when they come back. A lot of times that's something that's not going well is they're not sleeping with proper support for their necks or for the lower backs. So I want to show you how to sleep with better support for your neck or your low back. First thing you need to get out of the way is there's really no way to sleep on your stomach and have that be good for you. So, just too hard on your neck to turn your head like this in order to breathe causes your back to arch. There's some evidence of compromised blood flow to the brain when you have your head turned that far. So obviously we don't want to do that. Our remaining options are lying on your side or on your back. So let's talk about side lying first. For my neck, I need to have enough pillow support here to make up the distance between the outside of my shoulder and my head. If my pillow is too thin, I'm going to tilt toward the ground. If my pillow is too thick, I'm going to tilt away. So in my case, I've got a regular foam pillow as a spacer to give me some height there. And I've got a down pillow or a feather pillow on top of that to help to conform to my neck. So down is really great, a really great pillow to help to conform to your neck and give great support there. So if I lie on my side, I want to make sure my pillow doesn't land, I want to make sure my shoulder doesn't land on the pillow. I'm going to make sure my shoulder is on the bed. And then I take the pillows and I scrunch the down up and under my neck so that there's very firm contact between the pillow and my neck here. My neck has contact with that pillow the whole time. If the pillow is out here, it doesn't matter how good of a pillow it is, my neck is now not supported. So I'm going to take the down, scrunch it up underneath my neck, and now my neck is very well supported, pretty comfortable. Okay? I need to take that same concept and apply it to my low back now. So if I lie down on my side without any support for my back, my lumbar spine is doing the same arching toward the ground. If I take a small folded towel, maybe half an inch at the most thick, maybe 4 or 5 inches wide here, I'm going to put that just above my pelvic bone as I lie down. And now I've got my lower back supported with less of a bowing action toward the floor like that. The last thing I want to do in side lying is I want to support my upper leg. Legs have a lot of weight and they tend to put a lot of torque on your lumbar spine, even when you're lying down. So they'll tend to rotate me, okay? Put some strain on my back. I've got a real thick pillow here that I'm going to put between my legs. I'm going to make sure it's between my ankles, my knees, and all the way up to my hips so that my entire leg is parallel to the other one. If it's just between my knees, my legs aren't parallel because my foot is down lower than my knee. Or if I pushed it away from my hips, that's much less supportive. I've got to have it between my feet, my knees, and all the way up to my hips for lying on my side. Okay? So that's side lying. If I now lie on my back, I'm going to use the same pillow and turn it widthwise, and I'm going to put it all the way up to my hips and let my legs come down on that. Now that feels great. If I push the pillow just 2 inches down toward my knees, that's not going to feel nearly as supportive. So I'm going to have that pillow all the way up to my hips and both legs down on it. Now in terms of my neck now, I've got too much lift. My head's being pushed forward. So I'm going to take that spacer pillow out of there, just use the down pillow, do the same concept where I kind of dig a hole for my head and I push the down under my neck. So now I've got my neck really well supported and I can rest really well. So those are suggestions for sleeping positions so that you wake up in the morning feeling great. When you wake up in the morning feeling great, you continue to heal, you continue to progress, or you can keep yourself out of physical therapy in the first place. So thank you so much for watching. Go to my website, www.plachypt.com, P as in Peter, LACHYPT.com, or email me at mike@plachypt.com. Thank you so much. Have a great day.